Demand on your care. Care of a person with dementia. Wandering, and getting lost. In the middle and late stages of the development of dementia, the symptoms of wandering often occur. And there is a chance to get lost and endanger safety, or even lead to life-threatening, which not only makes caregivers very worried, but also increases the burden of care. Finding the reasons for wandering can effectively make care arrangements. Wandering may be due to memory loss. Due to cognitive impairment, unable to distinguish the environment and direction. Anxiety. Emotions of restlessness and anxiety, causing the patient to wander, or pacing aimlessly. Environmental changes. Unfamiliar environments, such as a new house, nursing home, or day center, can be unsettling and confusing. Physical discomfort or pain. Looking for food, because of hungry, or want to go to the toilet. Looking for the past. Deterioration of memory causes patients to only remember fragments of the past, and they will try to find people, things or places in the past. Express sullenness. Feeling idle, wandering may help pass the time. Here are some tips to prevent from getting lost. Regular life schedule. Set a healthy and regular life. Arrange activities. Arrange some activities that the patient is familiar with and can cope with, which can help reduce the chance of napping or wandering at night, and can also distract the patient from leaving home. Modify the environment. Familiar environment and living habits to increase their sense of security. Use color drapes to hide exits. Make good use of assistive devices, such as doorbells with contact sensor, bed alarms, lost alarms, etc., so that caregivers can know immediately when the patient leaves the residence. Wear a bracelet or necklace engraved with the patient's name and contact number, or so the relevant information on the clothes, so that others can contact the caregiver if necessary. Relieve anxiety. Accompany the patient for a walk or activities. Review old photos together with patients to make them feel familiar. If the patient is getting lost, keep calm. Use technology to find people. Using a device with a positioning function. Provide the octopus number of the lost person to public transport agencies, such as bus companies, for assistance. Use a tracing platform or social media platform, such as the Dementia's Secret Angel mobile app. Contact the building's management office to check if they have any clues. Attempt to go to the old home, his frequent or former workplace, to find. If you can't find him in the vicinity, you should call the police immediately and provide the police with sufficient information, such as the patient's height, body type, hair color, whether he wears glasses, whether there is a missing record, and the clothes he was wearing when he disappeared. And provide a recent color photograph of the patient. If the patient has gone home on his own, the police should also be notified immediately. After finding the patient, remember to comfort the patient and bring him back to a familiar environment as soon as possible. Do not show anxiety or berate him, as the patient may be confused and panicked. Please visit our website, Facebook, and YouTube channel for more information on elder care. Before you leave, remember to like and subscribe our channel.